Welcome to another deep dive, everyone. This time we're tackling mental health. Um, as nurses, I think we all know how important this is for, well, for all of us, really, but especially in our line of work.
Absolutely. And it's a topic that can get pretty complex pretty quickly.
Totally. So to help us unpack all this, we'll be looking at some of the insights from Lucy Folk's book.
Hmm.
Really dives into like how our understanding of mental illness has kind of evolved and the impact it has on society as a whole.
Yeah, it's quite fascinating, actually.
So what we're going to try to do today is, to equip you guys with a better understanding of what mental illness really is, what it isn't, and hopefully you can take some of these ideas and actually apply them in your work as a nurse.
Sounds good.
Perfect. So one of the things that really stood out to me in the book was this idea of concept creep.
Ah, yes.
So basically, how the definition of mental illness has like broadened over time.
Right, right. So something that, maybe years ago would have been considered, I don't know, just like normal sadness or stress, might now be labeled as a disorder.
Okay, so can you give us a real-world example of how this whole concept creep thing actually affects people?
Sure, yeah. So think about social anxiety disorder. In the past, someone who was, a bit shy, maybe felt a little awkward in social situations, they were just seen as shy. That was it. But today, those same feelings, I mean, if they're severe enough and they're actually, getting in the way of everyday life, they could actually be diagnosed as a mental illness.
Interesting. So on the one hand, this shift could help people, right?
Mm.
They might get access to treatment and support that they wouldn't have before. But on the other hand, it makes you wonder, are we maybe overdiagnosing things now? Or are we just, finally recognizing conditions that we just didn't see before?
Exactly. I think it's a really tricky balance, and it's something we need to be really careful about, especially as healthcare professionals.
Definitely. So what other examples are out there, things that show this changing understanding of mental illness?
Well, there's this pretty interesting one, the removal of the bereavement exclusion from the DSM-5.
The DSM-5, that's the big book they use to diagnose mental disorders, right?
Yes, exactly. So in the past, you wouldn't diagnose someone with depression if they were grieving, if they had just lost someone close to them.
Right, because sadness is just, well, it's a natural part of grieving.
Right. But now you can actually diagnose depression even after a recent loss. The idea is that, depression can happen at the same time as grief, and both need to be addressed.
Okay, I see. But could this lead to, I don't know, like misdiagnosing someone who's just going through a completely normal grieving process?
It's a valid concern for sure. Some experts worry that it might, end up medicalizing grief, turning something that's just a normal human response into like an illness.
So how do we as nurses kind of make sense of all this?
It all comes down to this,
Yeah.
understanding that mental illness, it's not, always a clear-cut thing. It's not always black and white. It's more like a spectrum.
Yeah, yeah, makes sense.
And that's where your assessment skills, the skills you have as a nurse, those are so crucial.
Okay, so it's not just about looking at like one symptom and slapping on a label, right?
Hmm.
We need to consider the whole picture.
Absolutely. The person's symptoms, their history, their life context, all of it. There's a huge difference between feeling anxious and having a diagnosed anxiety disorder.
So what's a key takeaway here for nurses about this whole concept creep thing and how our view of mental illness is changing?
I think the most important thing is to approach mental health with nuance. Don't just jump to conclusions or start labeling every negative emotion as some kind of disorder.
Right, right.
Really listen to your patients, try to understand what they're going through, and think about all the different factors that might be contributing to their distress.
It's about seeing the whole person, not just a diagnosis.
Exactly. And this is especially important, as we start to look beyond just the diagnosis itself. When we start talking about the role of stress and coping mechanisms in mental health.
Because it's not all about our genes and brain chemistry, is it? The
Yeah.
things that happen to us, the environment we're in, how we react to it, all that plays a huge role too.
That's right. Think of it this way. We all have a certain level of vulnerability to mental illness. Some of that's influenced by our genes, some by our environment.
Yeah.
So imagine a seesaw. Now, life events, whether they're big traumas or just everyday stresses, they can add weight to one side of that seesaw, and that can increase the risk of developing a mental health condition.
So stress can actually tip the scales, so to speak.
Exactly.
Yeah.
And it's not just about the event itself, it's about how the person copes with it. You see, sometimes people try to cope by avoiding or suppressing those difficult emotions. We call that passive coping.
Hmm. Passive
And
kind.
it might seem helpful at first, to just push those feelings down, but in the long run, it can actually make things worse.
Why is that?
Well, imagine you're trying to hold a beach ball underwater. You can do it for a while, but it takes a lot of energy, and eventually that beach ball is going to pop right back up to the surface.
Ooh, that's a good analogy.
It's the same with emotions. It's healthier to acknowledge them, to process them.
So how can nurses use this understanding of stress and coping in their work? What are some practical things they can do?
Well, the first step is being aware of the signs of stress in your patients. Are they going through a lot of changes? Are they withdrawing from social activities? Have their behaviors changed?
Right, so picking up on those signs.
Yeah. And once you've identified the potential stressors, you can start encouraging healthier coping mechanisms.
Like what are some examples?
Oh, there's all sorts of things. Exercise can be fantastic, relaxation techniques, talking to a friend, a therapist, anyone who can offer support. It's about giving them the tools to work through those difficult emotions.
Empowering them.
Exactly. And as nurses, you're in a really good position to advocate for your patients, to connect them with the resources and support systems they need.
So being that compassionate advocate, someone who listens, understands, and then helps them get the help they need.
Exactly. Sometimes just acknowledging a patient's stress can make a huge difference.
It can, can't it? Just letting them know that, they're not alone in this.
Absolutely. It validates their experience.
So now let's shift gears a little bit. Let's talk about adolescence.
Hmm.
It's a time known for, well, for a lot of ups and downs, right?
Sure, yeah.
Especially when it comes to mental health. It's a really, really vulnerable time. Why is this stage of life so important for nurses to understand?
Well, statistically speaking, adolescence is when most mental illnesses first appear. Like
Yeah.
the majority of them emerge by the age of 24. And puberty, well, that can be a major trigger.
Because of all the hormonal changes.
Exactly. Plus, the adolescent brain is still developing rapidly, and that can affect things like emotional regulation and impulse control.
Right. So teenagers are dealing with all these biological changes that can make them, more vulnerable to mental health issues. But it's not just the biology, is it? I mean, being a teenager is tough, all that social pressure.
You're absolutely right. We call it social reorientation. Basically, teenagers are trying to figure out who they are, where they fit in. They're dealing with social hierarchies, peer pressure.
They're becoming more aware of what other people think of them.
Right. And for some teenagers, all that social pressure can be incredibly overwhelming. It can contribute to anxiety, depression, and other mental health problems.
It's like trying to find your place in the world while going through all this internal and external chaos. So for nurses who work with teenagers, what are some of the warning signs to look out for? How can they spot a young person who might be struggling silently?
Well, often the first clue is a change in behavior. Is the teenager withdrawing from their usual activities? Are they more irritable, more angry? Are they having trouble concentrating?
Okay, so those subtle shifts in behavior.
Yeah. And also changes in their sleep patterns or their appetite. Those can be red flags too.
So it's about paying attention to those little things that might indicate something bigger is going on. And we can't forget about the role of family, right? Family support is so important for teenagers. How can nurses involve families in this conversation?
Nurses can play a really important role in educating families about the challenges of adolescence, talking to them about the importance of open communication, letting them know about the resources that are available to support their teens.
So building that network of support, a space where teenagers feel safe to talk about what they're going through.
Exactly.
And of course, we can't talk about the challenges facing young people today without talking about social media.
Oh, yeah.
It's everywhere.
Mhm.
And there's so much debate about whether it's good or bad for mental health. How can it be both?
Well, that's the thing about social media, isn't it? It's kind of a paradox. On the one hand, it can provide a sense of connection, of belonging, especially for, teenagers who might be feeling isolated or lonely. It can also be a great platform for sharing information and raising awareness about mental health issues.
I can see that. Finding online communities where you feel understood, where you can get support, that can be really powerful. But what about the downsides?
Well, social media can also make existing vulnerabilities worse. For example, if someone is already struggling with body image, seeing all these, perfectly curated images and unrealistic beauty standards all the time, that can be incredibly damaging.
It's that constant comparison game, right? Always feeling like you're not good enough, not pretty enough, not popular enough. And I imagine it can fuel anxiety too, that fear of missing out.
Absolutely. The constant stream of information and updates can create this sense of pressure, this urgency. It can lead to anxiety, sleep problems, all sorts of things. It really is a double-edged sword.
So how can nurses, navigate this tricky area with their young patients? It seems like such a minefield.
The key is to have open and honest conversations. Ask your patients about their social media use, how it makes them feel, what are their experiences like. Help them recognize the potential risks and encourage healthier online habits.
So things like setting boundaries, being mindful of their screen time, knowing when to seek help if they're struggling.
Exactly. It's about giving them the tools and knowledge they need to use social media in a way that supports their well-being. It's not about demonizing it altogether. It's about understanding its nuances and empowering them to make healthy choices.
And speaking of understanding nuances, there's another really important element we need to talk about: language. The words we use to describe mental health can have a huge impact on how we see it, how we understand it.
That's right. Language shapes our reality.
So how can nurses make sure they're using language responsibly when it comes to mental health?
It really comes down to, being careful about how we use words like depression or anxiety. Just throwing those terms around lightly to describe like everyday sadness or stress. I think it kind of trivializes the experiences of people who are really, truly struggling with those conditions.
Yeah, it's like when people say, "Oh, I'm so OCD about keeping my desk tidy." But real OCD, obsessive compulsive disorder, that's a serious thing. It can like really take over someone's life.
Exactly. And that kind of casual language, it minimizes what those people are going through. And, it just adds to the stigma around mental illness, which can make people even less likely to reach out for help.
So how can nurses, how can we be better about this? How can we advocate for using language in a more responsible way, both, in our work and just in everyday conversations?
I think it starts with education, with awareness. Like when you hear someone using mental health terms in a casual or inaccurate way, don't be afraid to gently challenge that. Explain the difference between just feeling anxious and actually having an anxiety disorder. Help patients and their families understand why it's important to use accurate language, respectful language. Words have power.
They really do. It's about setting an example, isn't it?
Yeah.
Modeling that sensitivity and awareness. But at the end of the day, it's not just about labels and diagnoses. It's about supporting people on their journey to recovery. It's about empowering them to live fulfilling lives.
100%. The diagnosis, that's just one piece of the puzzle. We need to move beyond just, slapping on a label and focus on helping people build coping mechanisms and resilience.
So beyond the diagnosis, what are some practical things nurses can do to help patients on that road to recovery?
Active listening is huge. Creating a safe space, a non-judgmental space where patients feel comfortable sharing their experiences, validate their feelings, let them know they're not alone.
That human connection, just feeling heard and understood, that can be so powerful.
Yeah.
What about like practical strategies? Are there tools nurses can give patients to help them manage their mental health?
Oh, absolutely. There are so many evidence-based self-help strategies that can make a real difference. Encourage your patients to prioritize sleep hygiene, to make sure they're getting enough rest. Explain the importance of regular exercise. Introduce them to relaxation techniques, things like deep breathing exercises or mindfulness meditation.
It's like giving them a toolkit, right?
Ah,
A set of coping skills they can use to manage their mental health. Are there any specific resources you recommend?
there are some great apps out there these days. Headspace and Calm are really popular for mindfulness. And for sleep issues, there's an app called Sleepio that can be really
Think
helpful.
about meeting people where they are,
Yeah.
right? Using technology and whatever resources are available to make those self-help strategies, more accessible, more engaging.
Exactly. And don't underestimate the power of simple lifestyle changes. Encourage a balanced diet, regular social interaction, spending time in nature. All those things can have a really positive impact on mental well-being.
It's about that holistic approach, isn't it? Recognizing that mental health is connected to everything else in our lives.
Yeah,
And sometimes the simplest things can make the biggest difference.
that's so true. And as nurses, you have this incredible opportunity to guide and support your patients in making those positive changes.
It's about empowering them, right? Giving them the tools and knowledge to take control of their own recovery, to navigate the challenges they face. Wow, we've covered so much today, from how our understanding of mental illness is changing to the importance of stress and coping, the unique challenges of adolescence, the whole social media thing, the power of language, and supporting recovery. It's been quite a deep dive.
It has been a thorough exploration for sure, and I really hope you feel better equipped now to understand and support your patients who are dealing with mental health challenges.
We've talked a lot about what mental illness is, but I think it's just as important to remember what it isn't. Sometimes we forget that feeling distress, feeling down, that's just a normal part of being human.
That's such a crucial point. We all experience sadness, stress, worry. It's part of life. It's what makes us human. And it's important to remember that those normal feelings are not the same thing as having a diagnosable mental illness.
So it's not about, turning every negative emotion into a medical problem. It's about recognizing when those emotions are so intense, so persistent, that they're actually stopping someone from living their life.
Exactly. And while it's obviously important to identify and treat mental illness, it's also important to build resilience. Life throws curveballs at all of us. We need healthy coping mechanisms to deal with those ups and downs.
So it's about finding that balance, right? Knowing when to seek professional help, but also empowering ourselves and our patients to develop those inner strengths, those coping skills that help us weather the storms.
Absolutely. And never forget, as nurses, you're not in this alone. You've got a whole community of colleagues to lean on, to share with, to learn from. Don't be afraid to reach out for support and guidance when you need it.
I feel like we've climbed Mount Everest of information today. We started with how our understanding of mental illness is changing. Then we talked about stress and coping, those unique challenges that teenagers face, the whole social media thing, and the power of language and how important it is to support people as they recover. It's been quite a journey, hasn't it?
It really has. We've covered a lot of ground. Hopefully, everyone listening feels more equipped to understand mental health now. And, maybe you feel a bit more confident in your practice, too.
I hope so. We talked a lot about what mental illness is, but maybe we should
Yeah.
touch on what it isn't for a sec. It's easy to forget sometimes, but just feeling distressed or down, that's just part of being human, right?
Absolutely. We all go through those ups and downs sadness, stress, worry. It's just part of life, what makes us human. And those normal feelings, they're not the same as having a mental illness that you can diagnose.
Yeah, we don't need to make every negative emotion into a medical problem. It's more about recognizing when those emotions get so big, so all-consuming, that they're actually stopping someone from living their life.
Exactly. And while it's really important to identify and treat those kinds of situations, we also can't forget about building resilience. Life is unpredictable. There are always going to be challenges. And developing those healthy coping mechanisms, that's what helps us get through those tough times.
Finding that balance, right? Knowing when to seek professional help, but also helping ourselves and our patients develop those inner strengths and coping skills. That's how we weather the storms.
Couldn't have said it better myself. And remember, for everyone listening, as nurses, you're not on your own in this. You've gotten colleagues, people you can talk to, share with, learn from. Don't be afraid to ask for help when you need it.
We all need support sometimes. Well, as we wrap up this deep dive, I want to leave you with one thought to take away. Understanding and addressing mental illness is so important, but we can't forget to celebrate how resilient people are too. Our capacity to heal and connect, it's really incredible.
So well said. Hold on to that, both for yourself and when you're working with your patients. And remember, never stop learning. Never stop asking questions. Keep fighting for better mental health care. You're making a difference every single day.
And on that inspiring note, we'll wrap things up for today. Thank you for joining us for another deep dive, and remember, the more we understand, the better care we can give.